No matter what a country scores, it's off a very low baseline because there are very few places in the world that have anywhere close to effective and evidence-based drug policies. South Africa scored 47%, and frankly, that's, in my mind, quite surprising. I think we score in areas where we don't have the death penalty, we don't have life imprisonment for drug offences, but in some ways we are really stigmatizing and criminalizing large proportions of the population. And we've bought into this whole prohibitionist drug policy narrative, and there's been very little critical examination of drug policy that was essentially inherited from the United States previously. And since the fall of apartheid, we haven't really examined that at all.
When I got arrested for possession of a tool to use drugs, of which it was not actual drug, but it was recorded as in possession of drugs, you know. And then on that, I got a fine of 500, of which I paid immediately. But then I'm stuck with that, you know, because it has been recorded as a criminal record, which really made my life difficult, you know.
I was arrested multiple of times in the streets for being in possession of drugs, and I was not accessing healthcare services because I knew that I was going to be stigmatized or discriminated against, as is the norm in the street, as we know that we are being discriminated against by society and everyone else.
I was arrested they find me with drugs. Like we're in a hotspot where we are smoking, like sitting smoking, and they came here and we tried to run, someone catch me, like that. I've been arrested for that, but the following day they've released me. But some other guys, they have been arrested for syringe without any drug evidence. Is a syringe.
Because we've seen a lot of the resources that were used to enforce apartheid used to enforce drug policy. And what I mean by that is some of the legal shortcuts that we see, people being denied bail when they patently should get bail, people being arrested when they could just be given a warning to appear in court. We see doors being kicked down without due warrants. We see people being stopped and searched, and this is all in the name of protecting people against the so-called evil of drugs.
My experience is basically some good, some bad, but most of the time you don't know what to expect from them, because I found that most of them are not trained to sort of like work or deal with people who are on drugs. A lot of them know what is going on in the area, and a lot of them are quite aware of where we get the stuff and who we are dealing with.
They arrest me for the knife. They saw with me at the knife. Then when they came there, they gave me the cocaine in my docket. They put a cocaine, and they put a mandrax, heroin. But they find me with a scrap knife. Then they said, this thing is for me. They're gonna charge me for this thing. Then they charge me. I stay in Westville for 6 months for the things I never did.
Women get stigmatized a lot. Women are seen as a caregiver. Women are seen as the person that brings you into. So it's very, very, now I have experienced it a lot. Being with your, then you call it Chantu. Can I mention that word? Yeah, you call it Chantu, you call it's a lot of words. It's just, yeah, how much will you pay? How much will you charge me just to sleep?
As a woman who uses drugs, you know, we've noticed with research and, you know, working with the community and being a woman who uses drugs, it comes up that if you're stopped by any form of authority, the likelihood of a bribe being expected, either monetary or sexual, is very high. And so it's either be arrested and sentenced for you don't know how long because of the inconsistencies of the sentencing. So it's either that uncertainty coupled with withdrawals of people, you know, if women are using opiates, that fear. Sometimes if a cop were to put that up against giving a blowjob, more than likely the alternative will be chosen.
It just communicates to the historical view of people who use drugs. The foundation of it is based on removing the substance and making people pay, whether it's from looking at it from a moral perspective. We've allowed all of these other elements and factors to threaten how we centralize patient care or people care. And these reflected in how I've seen even my clients suffer to get medical services because I come to be treated for a TB or a cough, and the conversation is about why are there track marks on you.
Going to healthcare facilities like hospitals, it is difficult going there because of the discrimination we face. I got pregnant while using, and it was difficult for me to start antenatal classes. I didn't go. Up until the time I gave birth, I never went because I was afraid of the insults, the stares, people pointing at me.
In hospitals, they curse you, they talk to you like you are a small child. You don't get treated the way you're supposed to. So then that's when we start missing our medication attendants. Then that's when we start getting sick. Unfortunately, we can't go back there to seek help because we know we don't get the right help.
People that stigmatize women as puppets. Men will get away with murder, but women will hear it every single day of their entire life.
With regards to gender-based violence, and specifically for women who use drugs, I still believe that there's still so much more we can do. There's a specific triggers that they experience, specific harms that they experience, and we have not created interventions that will serve specifically to them, and that is a point that we are continuously looking at better ways to serve women who use drugs and address those specific challenges that they get to face. I have one client who keeps popping in my mind who honestly, just because she's a woman, she was even treated lesser. I've even had community members, even other male substance users, who see and continuously view women who use substances as far lesser than males who do use substances.
I heard of a program, Course Up, but it was after 5 years of me using. I approached a guy who took me to Course Up, and you know what I realized at Course Up is that we do not have ladies, like as much women as the program needs. So when I got there, I was treated with dignity for once.
COSUP is an initiative to provide management, information, education on substance use for the substance user, their family, their community, and the city of Tshwane at large. We are based in we have 16 sites within the region of city of Tshwane. Some sites are community based, some are within specific healthcare facilities. So that's what we do. The aim is to provide harm reduction services for people who use drugs and people who inject drugs.
I work at the Community-Oriented Primary Care Research Unit. I was a substance user, and now I have the opportunity to help the community that I was part of. I was a substance user for 8 years. And the last time I used a substance was in 2017. I have had the opportunity, the support from COSUB, my family, the church. Because of how COSUB is set, it gives that opportunity to receive support all through. It's not one way for everyone, it's individual, holistic treatment.
So they introduced us to COSUP, where we started to take medication. So when I started to come to COSUP, it's where at least my life started to change a little bit, because I used to smoke in the morning. So when I started to get the medication, I become normal because I always wake up in the morning, wash myself, and do other job that I don't used to do.
The COSAP team constitutes of healthcare service providers, social workers, and counselors. We also have peer educators, with people who have experience with substance use, and community healthcare workers, which are individuals from that communities and serve to and have responsibility towards the health of their own communities.
We went to a place called Beleven, so I was still part of the program. I was volunteering, I was helping there and there. There was also some of us who were helping. So now, thank God I got a job now. I'm working there. So yeah. So I'm really trying to change my life. And the good thing about Beleven is that they don't charge you. Yeah, so they accept you the way that you are. They try to help you the way that you are. So no one is going to charge you. Even if you fall, they try to take you up. Even if you fall, they will try to take you up. No matter how many times you fall, but they will try to take you up until you're ready, until you're fit, then you can stand for yourself.
Belhaven is, I think, an exceptional space. It allows for people with a drug use disorder to enter with almost no barriers to access. And we see between 160 and 200 clients on a daily basis, most of whom access opiate substitution therapy at a suboptimal level because we don't have funding to be able to dose optimally. But we have noticed that even using a suboptimal dose, it's highly effective. I think the effectiveness of doing a methadone program, regardless of whether one is able to up titrate or not, is that people feel that for once, probably in their lives, and previously haven't had this before, they are able to engage in health-seeking behavior and to access services which are evidence-based and which we know have outcomes that are positive, particularly in relation to quality of life change.
I stayed here in December. I was smoking during December, but the second week I came here, I came to register here. I was drinking my methadone, but then mixing in December, and then I decided I had to stop mixing, so I stopped coming here to drink. I decided I'll come the following year, January, and so yeah, I came here from January. I was here, and I'm on methadone. And I even got, I'm employed here now. I'm a peer support, so yeah, it's really going well. And
I was doing bad things, housebreaking, I was stealing before to smoke a wonga. Then I started to came here, then after that I drink. It was my first day. The first day I didn't smoke at all because that thing there, you take all the pain, feeling you right, you don't have a craving that's to smoke. You feel right like you born. See. Then I go to my parents with a social worker to make a peace to them. Then I was trying to make a peace. Now my mother, she comes to help you about me now. Yeah.
Without Belhaven, I think our clients would be totally without hope and totally without any clue as to how to resolve their drug use disorder, which they want to do in their own self-determined way around achieving the goals of life normalization.
Streetscape is a harm reduction NGO that helps people that are in substance, who wants to change, but not forcing them to stop. Because I do believe like the angle they came to tackle this issue, it's, can I say, it's 80% effective. Like I said, I've been through many organizations, when it comes to substances. Most of them you are required to stop in order for you to get any help or to be accommodated. Streetscape is one of the few organizations that are helping people who are currently using.
But really, in terms of a proper investment in harm reduction, as a way of making it sustainable, that does not exist at all. Part of the problem for that is that the focus on reducing harm in policy in South Africa has no proper intervention strategy at all. And with the lack of that intervention strategy, I would say that it's the non-government sector that is guiding government at this point. And yet government is the stopgap. So they're guided by the non-government world, but when it comes to the non-government world giving recommendations around how to intervene and make the initiatives that exist sustainable, that's where government stops. Now, this is not to say that government is bad, because I think that they are struggling with their own internal dilemmas of the moral conservatism that exists within the South African government at all levels. And for me, that's often based on a sort of religious understanding that drug use is bad and drug users are bad, and the way to approach that is through ensuring that people abstain and to enforce prohibitionist approaches to drug use, all of which is counter to the very strong harm reduction policies that we find in South Africa as well. So these contesting policies and ideologies, I think, have allowed for a very slow movement in the South African context. And what it means, I would talk as someone who directs the Belhaven Harm Reduction Center, you know, it leaves us in a situation where we are having to constantly look for external donor funding, which is precarious, but it's also very conditional. So for example, in Durban, most of the user community are not injectors, but donor funding is very focused on injectors. So we have a huge problem there in accessing donor funding, which is always linked to HIV, which is always linked to injecting drug users. And so contextually, what is happening in South Africa is completely not understood by international donor organizations. And, you know, if we simply to look at HIV, the prevalence of HIV, which is of course very high in South Africa, is not from injecting and from same-sex interactions as it may be in the countries which are the donor countries. You know, it is a heterosexual transmitted disease in South Africa, very prevalent amongst the population, regardless of whether people use drugs or not. And so HIV then needs to be understood quite differently in South Africa than it would be in other places. But it seems to me that that lens of an alternative way of understanding population groupings has not been done very accurately. There will be implementation guidelines released pretty soon by National Department of Health, particularly in regards to opiate substitution therapy and the use of methadone specifically. This is positive, and hopefully there will be pilot sites that will be identified very soon in the beginning of 2022. But how those pilot sites are going to be identified and selected, and whether they're going to have to be at primary healthcare facilities that are government run, or whether they can focus on the existing ones such as Belhaven, which would be really great, we're not yet sure of. And so for those of us working in the harm reduction field at the moment, I can't say that we're not supported morally by government, because we are by those that are harm reduction advocates.
The perfect example is the relationship between National Department of Social Development and the South African Network of People Who Use Drugs. We've partnered together, and as a result, we are included in conversations. If there's a discussion around treatment, if there's a discussion around methadone, if there's a discussion around people who use drugs who need support in other areas, that's where that relationship comes in, because civil society organizations have information. We are sensitized, we are trained, we are experienced. This is our stories. And by being included in discussions related to our lives that are being had with government officials, having people use drugs in the room, having experts in the field in the room with you will shape the intervention entirely, and probably into something that is a lot more supportive rather than harmful.